There are different types of ovarian cysts, but functional cysts are the most common. Now, every month, your ovaries usually release an egg and it travels through the fallopian tube. But cysts can occur when, number one, the egg is not released from the follicle. This is called a follicular cyst. Number two, the egg is released, but the sac that the egg was in doesn't dissolve. This is called a corpus luteum cyst. Follicular cysts usually disappear in 1 to 3 months. The corpus luteums usually go away after a few weeks. Now, most doctors I know will give these cysts at least 6 weeks to disappear, and they usually do. And both of these cysts are virtually never associated with cancer, so don't you be alarmed. Barbara, what about polycystic ovaries? Well, with PCOS, the eggs mature in the follicles, but the sac never breaks open. So the little follicles stack up and repeat and repeat and repeat, and eventually you have what looks like a string of pearls when you see it on ultrasound. I have an entire video on this topic, and the link is below. Okay, let's talk size of ovarian cysts. Later in life, after age 35, women will sometimes develop a cyst that instead of collapsing and disappearing, may increase in size as the months go on. Some can become as large as a golf ball or even a lemon. Now, if the cyst is over 4 centimeters, your doctor may recommend surgery. A more conservative approach is to watch the cyst, as we just discussed. Most often, it will go away. Now, removing the ovary surgically along with the cyst used to be the standard procedure, but you ask your doctor to leave your ovary intact. You want to hang on to your ovaries if you can. Did you know ovaries are the anatomical equivalent of a man's testicles? They are the source of energy, libido, and hormone balance. Removing them is akin to castration. If your doctor tells you this will solve all of your problems, if we take out the ovary, I would personally think twice. Okay, symptoms of an ovarian cyst. Often there are no symptoms, but if the cyst starts growing, you can get abdominal bloating and swelling, pain in your lower back or thighs, painful bowel movements, pelvic pain either before or during your menstrual cycle, and painful sex. Now, there are some severe symptoms that would require more immediate attention. They would be sharp pelvic pain with fever, dizziness, and rapid breathing. These can indicate a ruptured cyst or an ovarian torsion. Torsion means the ovary gets twisted and moved from its original position because of the cyst, and the blood supply can get cut off, and if you don't treat it, it can damage your ovarian tissue. The most common treatment for this twisted cyst is surgery, and I would agree with that. But what about a ruptured cyst? That's a cyst that just breaks open. No one really knows why this happens. It can unexpectedly rupture during strenuous exercise or sexual activity. You'd feel a sudden, sharp pelvic pain. Treatment for a ruptured cyst usually involves medication for pain, but not surgery. Okay, ladies, do you have recurring ovarian cysts? What is the treatment? Well, doctors may prescribe birth control pills. This stops your ovulation, so no new cysts will form. But oral contraceptives can increase the risk of breast cancer, especially in young women. Good news, natural progesterone can be used to treat ovarian cysts with no adverse effects. How does progesterone help? Well, the mechanism that allows ovulation from one ovary every cycle is the product of progesterone production in that particular ovary. Then the other ovary shuts down, so you don't get 2 eggs coming from 2 ovaries. Otherwise, we'd all have twins for children. If you use sufficient progesterone prior to ovulation, the luteinizing hormone levels are inhibited, and both of the ovaries think the other one has ovulated, so they don't ovulate. Thus, the cysts won't be stimulated, and in 1 to 2 cycles of using the progesterone like this, they will shrink and disappear with no negative side effects. How do you use it? Use it day 10 through 26 of your cycle. 1/4 teaspoon twice a day. Continue, half teaspoon. You want to up it with when you're treating cysts. Continue for 3 cycles to temporarily suppress that ovulation for the 3 months. On the 4th month, you go back to day 12 through 26 at your 1/4 teaspoon per day, and your ovulation will usually occur, and you're back to normal. Prevention, it's hard to say for sure that ovarian cysts can be prevented. Many women will experience a cyst over their lifetime, and as I said, they disappear within a few months. You may not even have known you had it. However, the recurring ones can occur if you're premenopausal and you have hormone imbalance. So you want to take your progesterone cream, and if you want to be aggressive, I would keep your liver healthy with milk thistle, because that filters out the harmful xenohormones that exacerbate cysts. Also, you can do an estrogen detox with DIM. So, I love ProHelp for your progesterone cream. I developed it with the help of Dr. John R. Lee, a genius of hormone balance. So one more thing, if you're having PCOS and you're watching and you want to get pregnant, please treat it. Use natural progesterone, because PCOS can lead to infertility. So you can find that information on the video about PCOS, or visit the fertility shop on my website. I'll put the links below. You all know I'm an educator through and through. I want to help you. Take care and write to me with your questions. Just give me 24 to 48 hours to respond. Thanks for watching.